When it comes to appendicitis, the earliest symptoms may be difficult to spot. They can include a loss of appetite and nausea, but the main symptom is abdominal pain. Usually the pain starts around your belly button or mid-upper abdomen and then moves downward to the lower right side of your abdomen. It can be very sharp and severe at times. 1. Abdominal pain. Pain in the abdomen can come from just about any organ that's surrounded by the abdominal cavity. But sometimes the pain is a sign that something serious is happening. Your doctor can determine what the cause of your belly pain is by taking a medical history and performing a physical examination. Blood tests, a CT scan or ultrasound may also be needed to make the diagnosis. Most abdominal pain isn't a reason for concern, but if it persists or gets worse, call your doctor right away. It's also a good idea to get checked out if you experience fever, a lower grade fever, nausea or vomiting that doesn't go away, bloating or distension in your abdomen, weight loss or yellowish skin. 2. Diarrhea. Diarrhea is a common condition that occurs when the bowel doesn't work properly. It can happen when a person has a bacterial, viral or parasitic infection. It's usually short-lived, lasting no more than a few days and then going away on its own. However, if diarrhea lasts more than 2 weeks or a child is vomiting for a long time, it's important to see a doctor. Most cases of diarrhea are caused by viruses and bacteria. Other illnesses can also cause diarrhea, including irritable bowel syndrome, IBS, and certain digestive disorders like ulcerative colitis or Crohn's disease. 3. Fever. A low fever, 99 to 100.4 degrees Fahrenheit, is one of the early symptoms of appendicitis. If your fever gets higher, you should see a doctor right away. A high fever, over 100.4 degrees Fahrenheit, can be a sign of appendicitis that has ruptured. If it does, you may need urgent surgery to remove your appendix and prevent the spread of infection in your abdomen. The body produces a fever when it senses an infection, inflammation, a drug, or a non-infectious cause, such as an autoimmune disorder. In these cases, the immune system triggers a process in which it makes chemicals called pyrogens. These pyrogens affect the hypothalamus, the part of the brain that regulates body temperature. 4. Nausea. Nausea is a symptom of many different conditions, but it can be especially difficult to know when nausea is just part of a normal stomach discomfort and when it's a warning sign that something else is wrong. If you're experiencing nausea, it's important to speak with your doctor to find out if it's caused by appendicitis. You should also keep hydrated, as this may help to relieve nausea when it occurs. The pain from appendicitis can start near the belly button and shift downward to the right side of your abdomen. This pain can be very sharp or a dull, constant pain. 5. Vomiting. Appendicitis is a painful inflammation of the appendix, which is a small tube-like organ that's attached to the cecum. The appendix is located on the right side of the lower abdomen and is often removed as part of emergency surgery. Symptoms of appendicitis can range from mild to severe. It's important to call your doctor if you experience sudden and severe abdominal pain, diarrhea, vomiting, or fever. A physical exam is the best way to determine if you have appendicitis. Your doctor will press on the area where you feel pain and examine your rectal and pelvic tissues. They may also ask for blood and urine tests.